I am Dr. Achala, Abeywardena, consultant in obstetrics and gynecology. Today, let's talk about fibroids. What are fibroids? Fibroids are growths in and around the womb. They originate from tissue similar to the muscle layer of the womb. According to research, their incidence vary from 30% to 70%. How do they manifest? How would a patient know that fibroids are inside her womb? Most of the fibroids are not symptomatic. They are detected by clinicians on routine examinations or by an ultrasound scan done for other reasons. When they are symptomatic, there could be abnormal bleeding. There could be heavy periods, increased duration of periods, and bleeding in between periods. Pain is the second commonest presentation of fibroids. Fibroids could cause pain in the lower tummy. Sometimes pain during periods is a presentation. Backache is another presentation with regard to pain. Infertility is a common presentation of fibroids. When patients are investigated for infertility, fibroids could be detected. As we all know, has bladder in front of it and bowel behind it. When the womb gets enlarged with fibroids, it could compress on bladder as well as on the rectum and causes increase in urinary frequency as well as urine retention or increase in bowel motion or constipation. Pregnancy complication is another presentation. Sometimes miscarriages could happen, sometimes early delivery can happen due to fibroids. How do an experienced clinician find fibroids? They will examine you. Mainly they will do an examination of the tummy as well as the vaginal examination, and an experienced clinician can suspect fibroids in you. How do we confirm that? Usually ultrasound scans are done to confirm fibroids. Ultrasound scan is a cheap and freely available investigation. It could identify fibroids as well as determine the number of fibroids and the impact of fibroids on the womb. When fibroids are detected, what can be done? Clinicians will discuss the plan with the patient. Fibroids are not symptomatic. Watchful waiting may be the approach that clinicians take. When the fibroids are symptomatic, clinicians could offer medical as well as surgical treatment. Medical treatment might be either hormonal or non-hormonal and is mainly offered for bleeding as well as pain. More permanent sort of management is surgical. The surgical management would be either removal of fibroid, which is called as myomectomy, or removal of the womb, which is called as hysterectomy. That could be done in two approaches: the open approach or keyhole approach or laparoscopic approach. Traditional open approach is now overtaken by the laparoscopic or the keyhole technique. In our hospital, we offer both surgical techniques and we try to resort mostly to keyhole surgery as it is more helpful for the patient. Less bleeding, less pain, early mobilization and quick return back to work are key advantages of laparoscopic approach. We could remove fibroids as well as remove the womb, that is hysterectomy could be offered by laparoscopic approach. I hope you gained a lot of knowledge on fibroids and how we manage fibroids. Thank you.
Kings නිරතුරු විශ්වාසයෙන් ඔබ ළඟ රැඳෙන්නම්.